Can you just describe it for us? What is that procedure like, and
Sure.
how does it work?
Yeah. The way we find the lymph node is the day of the surgical procedure where we're excising the melanoma. We also have our nuclear medicine physicians inject the site with a radio tracer. And this radioactive tracer then travels through the lymphatics, just like if it were a melanoma cell. And then it progresses through the lymphatics to the sentinel lymph node, the first lymph node that the lymphatics would come in contact with. And that would be located in one of the lymph node basins.
Like the armpit.
Right, like the
Okay.
armpit or the neck or the groin. And then the patient is then taken to the operating room. And in the operating room, I have this little Geiger probe, I call it. And I'm able to find the radioactivity where it's the strongest. So this substance that is injected remains within the lymph node. It's a sulfur colloid that remains within the lymphatic system and the lymph node. So I'm able to trace the radioactivity to this lymph node. And then I make a small incision over the area of the highest radioactivity counts on the skin. And then I investigate this lymph node basin to find the lymph node utilizing my Geiger probe.
When you say investigate, what does that mean?
I make an incision and then I explore the area, and utilizing my Geiger probe, I find the lymph node that has the highest radioactivity counts.
Got
And
it.
it may be more than one, because oftentimes we'll see that there's some redundant pathways of the lymphatics and may go to several lymph nodes. So we remove all the lymph nodes until the lymph node basin decreases to less than 10% of the highest radioactivity counts within the sentinel lymph node. And that's when we know we finished the search for our sentinel lymph node.
Got it.
All the lymph nodes are then submitted to pathology. One common misconception is that patients get this injection and they think, oh, it's gone to my lymph nodes, so that means I have metastatic disease. I want all my patients and make sure during our consultation that they don't feel this way, because this is a normal process. So everybody has a sentinel lymph node on every part of their skin. And our job is to find that lymph node so that we can give the whole lymph node to our pathologist. And then it's the pathologist's job to section through the lymph node, do their special stains, and determine whether there are any melanoma cells within the lymph node.
Yeah, so this is very, very important, right? Because we talked about, there's something called a clinically occult lymph node involvement. So that's what you do using a sentinel lymph node biopsy procedure to find that quote unquote occult, which means you can't feel it based on clinical exam. And the problem is that once you find the lymph node is positive, you get upstaged, right? And that becomes stage 3, you have lymph node disease. Now, before we get into what